I would go to my own parent institute's scientist, Dr. Roopa. So I would like to tell us about the current landscape of medical research in India. I think in working in NCD division of ICMR, you must be having a good information about it.
Thank you so much, Dr. Bagga, and thank you for inviting me to be part of this August gathering. That's a very loaded question to talk about the whole landscape of medical research in India. I mean, I can just talk more about what are the potentials that exist within the medical research in India. And Honorable Ramesh Chandraji in the morning touched upon this matter. Right? So, number one, our strength, whatever said and done, is the population, right? The humongous population, what we have got, and the number of patients, what we see in our country, can be unmatched with. The example he took between Romania and India is a very important example, right? And most of the clinical trials, when I get it in, whether it is the application through Health Ministry Steering Committee or others, I know they all want India to be part of their research just for the sheer numbers. And we should use that strength as a medical research community. Second is diversity. The diversity of population in our country is huge. And third is trained clinician. We have huge number of trained clinician and physician, which we export a lot to the other countries, but we have humongous number. There is infrastructure. There is governance for research, at least it's improving, and we are not like, it may not be perfect, but we are improving over time with the governance of research. So, and we are also pharmaceutical capital of the world, and even there is improvement in what you call the bioengineering parts of the country, biotechnology in the country. So yeah, but given all this, where do we lack? Where do we lack? I think what Dr. Singhal touched upon is a very important. We don't have the research-trained clinicians, right? Whether even the MD thesis are done in a very shabby way in a most part of our country, and not to blame the residents or the clinicians, it's only because they don't have a protected time to conduct research, which is unfortunate. And the people who are sitting next to me, Dr. Singhal and Dr. Madhu, they really go out of their way, like they take up their weekends and other times to do research.